The Chuvash Republic is situated in the center of the European part of Russia. A relatively small territory of 18.3 thousand square kilometers is home for some 1.3 million people. About 40% of them reside in rural areas. According to Vladimir Starodubov, the Deputy Minister of Health and Social Development of the Russian Federation, the Chuvash experience was largely considered when designing the National Health Priority Project, since the key thrust is on improving availability and access to primary healthcare services. The experience of the Chuvash Republic must be replicated all over the country. In 2002, the Ministry of Health of the Russian Federation identified the Chuvash Republic as a pilot region for the implementation of the World Bank-financed Health Reform Implementation Project. At that time, the Republic was the only region of the Russian Federation that had pioneered healthcare services provision in accordance with the strategic plan for restructuring the system of medical care provision for the period of 2003 to 2008, approved later. The implementation of the $30 million project, of which $10 million were allocated to the Republic, was scheduled for 5 years, from 2003 to 2008.
People in government of the Republic of Chuvash have been a most trusted partner for the World Bank over the last almost 2 decades. We especially admire the prudent ways in which the government of Chuvash handles its budget, its financial obligations, its fiscal obligations to the people in a very transparent manner. And we also appreciate the way government has set up its healthcare system. Some outstanding examples, such as the President Perinatal Center, just are remarkable and may well serve as an example for the Russian Federation as a whole.
The Health System Restructuring Plan, supported under the Health Reform Implementation Project, was approved by the Republican Cabinet of Ministers, supported by the specialists of the Ministry of Health and Social Development of the Russian Federation, and endorsed by the World Bank experts. The primary healthcare level is at the core of this restructured healthcare system. The restructuring of the healthcare system was carried out under the decree of the President of the Chuvash Republic. Additional measures were adopted for the development of the family medicine program at the primary care level, and the approval of the family medicine program allowed instituting general practice and family doctors in the Republic. The first 18 GP offices were opened in 2001-2002 with financial participation of the Canadian International Development Agency. Within the framework of the Health Reform Implementation Project funded by the World Bank, the equipment, including diagnostic and treatment equipment and information technology, was procured for 160 GP offices. In addition, 250 general practitioners were trained by the State Educational Institution Medical Institute of Continuous Education, and 780 nurses for GP practice were trained by the Cheboksary Medical College. Today, Chuvash GPs serve about 50% of the population of the Republic, compared to 13% in 2003. In rural areas, more than 60% of the population gets medical treatment from GPs or family medicine doctors. In 2004, a new performance-based GP remuneration system was introduced in the Republic in order to increase the quality of primary care, linking the allocation of additional funds to the achievement of specific health targets. To evaluate the quality of healthcare services provided to the population in the different facilities of the healthcare system in the Republic, a new methodology was developed that employs 30 indicators that allow the close monitoring of performance in the health system. The introduction of general practice and family medicine extended the range of health services provided to the population, thanks to well-trained primary care teams and increased technological capacity of the centers. 476 beds for day patients were set up in GP departments. The number of cases treated increased 2.5 times in comparison with 2003. The level of hospitalization for 24-hour patients dropped from 3.6 in 2004 to 2.8 per 100 people in 2007. The number of patients subjected to home care almost doubled. The number of emergency calls to ambulance services for chronic cases decreased by 25% between 2002 and 2005. Substitute technologies were introduced as an alternative to inpatient care. The number of beds for daycare patients increased by 19%. The number of treated patients more than doubled. Prevention and early detection of diseases and improved access to quality services provided by GPs reduced the need for hospital care and utilization of emergency services in hospitals for routine events, and helped to reduce the number of ambulance calls, including unjustified ones. The overall economic impact of the GP introduction was close to 120 million rubles. It is expected that by 2010, all adult population of the Republic will be on a regular basis served by GPs and family medicine doctors. This would require setting up, equipping and staffing up to 250 GP offices. District general practitioners were made responsible for coordination of the provision of medical treatment, including the management or planning of hospital services for inpatient care, assuming a gatekeeper function within the health system. That resulted in the introduction of per capita financing with partial or full fund holding. Mapping of federal and regional roads on the territory of Chuvash according to the zones of responsibility helped to dramatically reduce the time needed to bring victims of road accidents to medical institutions. It also helped to decrease the death toll of road accidents by 7% and disability by 15%. Interregional medical centers started to operate across the Republic. Their operations are based on schedules for medical treatment provision and intergovernmental mutual payments between other healthcare and prevention institutions. The above-mentioned centers were equipped using funds from the regional budget and the World Bank project. The establishment of interregional medical centers provided possibilities to concentrate resources and to improve access of rural population to quality specialized medical care. In the Chuvash Republic, the overall economic effect of the healthcare restructuring amounts to 500 million rubles. This facilitated the reallocation of public funds for healthcare and creating opportunities for attracting investment into support of state-of-the-art medical and information technologies. The most important point to highlight is that in Chuvash, unlike many other regions of Russia, there is no oil, gas or metals. The development is nonetheless positive. I would even say higher than the country average due to efficient organization of work and intellectual input. I think it is to a great extent thanks to the way the work is organized. It is a good example to follow.